welcome to my channel. And in this channel, actually, I'm going to share with you the counseling tips for most of the commonly prescribed medications and also over the counter medications. So, today I will explain the side effects of hydrochlorothiazide in a simple and easy to understand way. Hydrochlorothiazide is a commonly used water pill for blood pressure, but like all medications, it has some side effects you should be aware of. And before going forward, just to let you know that this video is for informational purposes only and is not a substitute for any professional medical advice. If you decide to start or stop any medication, always consult your doctor or pharmacist. So first of all, what is hydrochlorothiazide? Hydrochlorothiazide is a widely used medication for high blood pressure and fluid retention. And the fluid retention is also, which is also called edema. It may be caused by certain medical condition or it may be caused by some of the medications. The medical condition which can result in edema, the examples are like congestive heart failure, liver disease or the kidney disease, or if someone is being treated by steroids or hormonal medications or many other medications which may result in water retention. So hydrochlorothiazide is a diuretic. It is also called a water pill, and what it does, it helps your body get rid of excess salt and water. So the most common side effects, they are increased urination, especially in the beginning, and this happens because of its mechanism of action. It reduces the amount of water in the body by increasing the flow of the urine. And because of this increased urination, you might feel dizzy or you might be lightheaded. And it also, because of this mechanism of action, there might be some mild dehydration or the low potassium levels. And if you are experiencing any weakness or the muscle cramps, then it may be because of the side effects, which is low potassium levels. There might be some serious side effects. In that case, you need to talk to your doctor, and your doctor might need to adjust the dose or change the medication. So the serious side effects are electrolyte imbalance, which is very, very low sodium or potassium levels, and irregular heart rate. Irregular heart rate is also it might be an indicator of decreased electrolytes, or which is they are not in the normal range, and it may result in severe dehydration. It can also increase the blood sugar levels. That's why, while if you are on this medication, your doctor might advise to have the labs after a couple of months to make sure that it's all within the normal range. And the very important side effect, I would like to mention, which I observe this in everyday practice, that people, they come here and they ask about their sunburns or other skin medical conditions, like, and in this case they think that there is some allergic reaction because of the sun. What happens that this medication, it makes your skin sensitive to sunlight. So in that case, just to avoid any sunburn or any other condition, which we call photosensitivity or extreme sensitivity to sunlight, I highly recommend like wearing a sunscreen of at least SPF 30, which is called also sun protection factor 30, when you go outside. And another side effect, which may happen, is the gout flare ups. If someone has gout because of the increased uric acid levels because of that medication, so it may result in some flare ups. So, when to seek the medical help? This is very important. If you start that medication and you notice severe dizziness, like muscle weakness, it's really hard to do anything, or you feel like you are numb, and you are you don't have any clarity of mind or clarity of thinking. There is some confusion, or your heart rate is increased or rapid heart rate, or you don't feel comfortable. So in that case, you need to talk to your doctor. So it may happen because of the side effect, which is electrolyte imbalance. In that case, either the doctor, they need to, they might refer you to have the labs to make sure that your all the electrolytes, they are within the normal range, or they might suggest some dose change. So the quick safety tip to avoid these side effects is, first of all, to stay hydrated. And the second is avoid the excessive sun exposure, because sun exposure may increase your risk of getting the skin cancer. And so it can lead to severe sunburns. So in order to avoid that, just try to avoid the peak times, when the sun is at its peak, the sun rays, between 12 to 4, or if there is a need to go out, just wear sunscreen and follow your doctor's advice. Your doctor might advise you some lab work, so it's very important to follow your doctor's advice and just have the labs. It is important for monitoring your all your levels, your uric acid levels, your blood glucose levels, and your electrolyte levels. These are some of the references which I use for my these all these counseling tips. So, friends, if you like my effort, if you like my sharing of this information, so please do subscribe to my channel and share with your friends and family. This is an encouragement for me to make many new and interesting videos.